Hello, everyone. How are folks doing today? I hope you guys are as excited for today's conversation as I am. It is sure to be amazing. So let's get started. I'm excited that you have joined us for today's important and timely conversation about building up Black girls' resilience and well-being through gender-specific and culturally affirming mental health services and supports. This is the first conversation in our series, Let's Link Up, Your Voice Gives Me Strength. I am Sydney McKinney, the Executive Director of the National Black Women's Justice Institute, a national nonprofit organization leading efforts to research, elevate, and educate the public about innovative, community-led solutions to end the criminalization of Black women and girls. And it is my honor to be co-hosting this event and series with the Western area of the Links Incorporated. Thank you, Lorna Hankins, Western Area Director of the Links Incorporated, and Wendell Washington and Carla Penn-Hobson for your support and partnership. As we were planning the Let's Link Up series, including a discussion about Black women and girls' mental health was an easy decision. As Black women ourselves and formerly Black girls, we are acutely aware of how challenging it is for Black women and girls to nurture and sustain our mental wellness. As Black women, every day we are confronted with racial and gender discrimination. We all carry with us historical trauma as descendants of women and men who were enslaved and brutalized in this country, and many of us have also experienced personal trauma and harm as well. Yet the mental health system was not created with us, for us, or by us. Only 4% of psychologists in the US workforce are Black, and community-based services that are gender-specific and culturally affirming are not invested in or have the same visibility as traditional mental health services. As a result, our needs are unaddressed and go unmet, which has dire consequences. As shown on the fact sheet we created, which we're sharing in the chat and is available on our website, suicide rates among Black girls rose 182%. I just want to say that again, 182% from 2001 to 2017, while suicide attempts among youth across other races and ethnicities declined. And the overwhelming majority of women and girls who are incarcerated are struggling with severe mental health issues. Can you imagine how many Black girls would still be with us today and how much we could cut the number of Black women and girls who are directly impacted by the juvenile and criminal legal systems if we made gender-specific, culturally affirming mental health services easily available in our communities? Building up resources in our communities to support the mental health and wellness of Black women and girls is liberatory work, and that's what we're doing here together today. Our panelists include 3 incredible and inspiring Black women who have made it their life's work to restore the mental health and wellness of Black women and girls, especially the most vulnerable among us. Today, we will dive into why this work is vital to our collective health and well-being and what we as individuals and as a community of Black women can do to nurture, restore, and sustain our mental health and wellness. So let me introduce our esteemed panelists. First, we have Dr. Jennifer Davis. She is a member of the Fresno chapter and the Western Area Links Incorporated. She is the Mental Health Committee Chair and a licensed clinical psychologist. She is a senior psychologist supervisor at one of the largest women's correctional institutions in the world. There she directs a mental health program which serves approximately 100 women who have been diagnosed with severe mental health issues. Next, we have Lauren Carson, an Atlanta native and University of Virginia alumnus. She is the executive director and founder of Black Girl Smile, Inc., which is a nonprofit organization dedicated to promoting positive mental health, education, resources, and support. Through her work with Black Girl Smile, Inc., and as a mental health advocate and speaker, Lauren has been featured in South by Southwest, Clinton Global Initiative University, American Psychiatric Association, Refinery 29, Red Book, and Hers magazine. And she made Young Nonprofit Professional Network of 30 Under 30. And last but definitely not least, we have Brianna Baker, who is the founder and executive director of Justice for Black Girls. The mission of Justice for Black Girls is to expand global knowledge of the ways US-based systems of power respond to and perpetuate the abuse of Black women and girls in schools, in prisons, and in protest. The work of JBG focuses on honoring the fullness of Black girlhood in ways that disrupt the systems that dishonor Black girlhood. This work elevates Black girls as the experts while creating space that enables Black girls to imagine a life beyond the confining structures in which they currently live. Brianna Baker is a social justice educator, scholar, and juvenile justice advocate who is fervent about creating spaces that unconditionally affirm Black girls and girlhood and brilliance. Before we jump into the discussion, I do want to share a brief video to help ground what we will be talking about today. And it is from a young person named Samantha Giles. She is age 17 and she is a junior in high school. She is connected with Black Girls Smile Inc. And she wanted to share with us today why it is important that we elevate and support the mental health and wellness of Black girls.
I think the support that would help me is having a therapist that looks like me. I think that would allow me to not only relate to them, but also feel more comfortable talking about my experiences of racism with them. I think what society doesn't understand about Black girls' mental health is that we are constantly hyper-masculinized for our skin tone, and that hyper-masculinization causes anxiety, especially in dark-skinned Black women. I think that mental health support for Black girls should look like upliftment and encouragement. Having a good and strong support system for Black girls will definitely help our mental health. What we could be doing different is having more Black women in TV shows and movies that are the lead. I think that having the next star of the next big movie be a Black woman will definitely help Black girls' mental health, because they look like them and it's someone that they can relate to. I think that schools should have more policies to protect Black girls and at least have a Black student union. And I think that having staff and teachers that look like Black girls will also help Black girls' mental health, because then they feel more comfortable to go and talk to them if they experience racism in school. And I think that mental health professionals should know that Black girls experience racism and sexism from the moment they are born. And that racism and sexism can cause us actually to experience depression. And I think that understanding that we are treated differently than other people will definitely help mental health professionals when treating and helping Black girls. Thank you.
Thank you so much, Samantha. She's not here with us right now, but those words are powerful. We could almost end today's event after that video and be done. And I see Lauren, who's beaming and so proud, and you should be, because what she shared with us is just so important, and it's why we're here today. So with that in mind and that grounding us for today's conversation, I want to jump in and talk to the panelists. And so first, we'll just do a round robin where each of you can tell us how you got into this work that you're leading and what motivates you to continue. So let's start with Lauren. Tell us about the work you're leading and what motivates you.
Hi, everyone. Thank you, Sydney, so much for convening this panel. This is just such an amazing experience. I got involved in this work because I have lived experience as a Black woman and girl with clinical depression, anxiety, and suicide attempts. I graduated from college. I really was looking to volunteer, like a lot of young professionals, and quickly found that there were very few organizations, if any, that spoke to the needs of young Black women as it pertains to mental health and mental well-being. Started to convene some focus groups and saw that there was definitely a need in this space, and started the organization in 2012. What really keeps me grounded in this work is young women like Samantha that we work with, that to hear her speak and just so well-spoken at 17 years old. She has a strong grasp on the differences and disparities that young Black women experience when it comes to mental health and well-being and just overall, our interactions with society. So working with young women like Samantha, providing additional resources, support, and educational opportunities for young Black women to feel empowered with their mental health and well-being, to feel supported. That's really what grounds me in the work.
Thank you. Dr. Davis.
Good morning, everyone. Sydney, thank you so much for having me here today. I am so excited to be here with you all. So as was discussed earlier, I serve as the Western area of the Links Incorporated Mental Health Committee Chair, and I was so inspired and so motivated by the great work that was already being done in the organization as it related to mental health programming. I also saw areas where we could grow even more. So to date, 90% of our chapters in the Western area have a designated mental health chair, and we are so proud of that in the organization. These are Black women who are focused on providing mental health education as well as resources to their chapters and their communities. And we always talk about how that can change someone's life. We serve in the Links Incorporated underserved communities. And so it was really important to us to have this mental health aspect. In my professional life, as we discussed, I'm the clinical director of a mental health program. I work with chronically, severely mentally ill women. So correctional institutions are the largest providers of mental health treatment in this nation. So when you think about what does that mean for Black women, because Black and Brown women are so overrepresented within the correctional system, and it's really part of what drew me to this work. So many times the women that I encounter, it's the first time that they've received mental health treatment. So often they've had a lifelong history of these really severe mental health symptoms, and they've never gotten treatment. And so we've discovered time and time again that one of the most curative factors in therapy is a strong therapeutic alliance. That cannot be overstated. So it's not a prerequisite that you need to have a therapist that looks like you, but that can be really transformational. We heard the young lady at the beginning say that was important, to have a therapist that looks like you. And as Sydney said, only 4% of psychologists in this nation are Black. And so I was so drawn to the work that I do, both professionally and within the Links Incorporated. And so girls like the one that we saw that said, I want a Black therapist, so that's important. That's really what continues to motivate me.
Thank you so much. And Brianna.
Yes, so just to echo what everyone else has stated, it's just a privilege and honor to share space with Black women. I'm really excited to be here. And just for Black girls, our work is so deeply connected to the belief that Black girls deserve to be actively poured into and actively restored. So much of this work is centered on disrupting the systems that interrupt their girlhood. And so much of our work is about resisting adultification of Black girls and resisting criminalization of Black girls. But once Black girls are in spaces where they are no longer adultified, right, where they're no longer criminalized, how are we actively pouring into our babies? How are we actively restoring them, right? Because so many systems operate against their personhood and their humanness, right? And so much of our work and what grounds me in this work is that Black girls deserve to dream, imagine, live, love, have joy, healing, right? And some of the beautiful experiences that we're not always concerned if we're doing this work from a deficit mindset. And so what grounds me in this work is the unconditional belief that I'm still healing the inner Black girl that lives in me. And while I'm healing the inner Black girl that lives in me, Black girls around me have to heal as well. And so that we work together and we're journeying with healing together as we navigate the spaces that bring us, that harm us, but we chase the spaces that restore us.
I love that. We chase the spaces that restore us. That is so important, and that is why we are here today. And another thing that Dr. Davis, you said that I think is so important is just that supporting and nurturing the wellness of Black women can change lives, right? That this is transformational and just so important that we keep this in mind, right? I think as individuals, we don't always do a great job of prioritizing our mental health and wellness. And also the system is not helping us in that. And so it is just so important to keep our eye on the prize and like just trained on that as a goal, because it can change our lives as individuals and change our communities as well, and just so important. The one thing that Samantha brought up, and you guys have shared in your opening remarks, that the trauma that Black women and girls experience is overlooked and ignored. And I'm hoping we can talk about, from your perspective and the work that you do, why is that? And what can we do to elevate this issue of mental wellness and healing of Black women and girls within our communities and among the public at large, so that this isn't just something that we're talking about on this call, but we are starting a movement, and we are part of a movement where this is a conversation that is happening everywhere. Who would like to go first?
I will. The really harsh reality is that Black women's trauma is overlooked because we are overlooked. Trauma in our communities is commonplace. So we have the trauma of life experience, but we have it coupled with racism, day-to-day racism, that can eat away at you slowly. And it's so common that sometimes we don't even recognize that it's happening. So what can we do? How do we elevate those issues? So one thing is reducing the stigma. So unabashedly discussing our own struggles. There was a study that I read recently that found that Black teenagers are far more likely than white teenagers to shun and stay away from people that they think have a history of mental illness. So what does that mean to somebody who goes to school every day and they're experiencing trauma in their homes? Who do they turn to? And so when their providers don't look like them and the people that do look like them are shunning them, where do they go? So to answer your question, what do we do about this? I repeat it over and over and over again. It's normalizing. It's erasing the stigma that so many Black girls experience every day.
Definitely. Lauren.
I think just to echo Dr. Davis's point, for us as Black women, it's starting to model these positive behaviors, these positive mental health strategies, coping skills, self-care methods. Even if we are not a mother, I have a 2-year-old now, so still learning throughout the process. But we play so many different roles in Black girls' lives. We're mentors, we are aunts, we are sisters, we are cousins, youth leaders. It doesn't matter. We play so many different roles in Black young women's lives and girls' lives, that the more we can start to, as Dr. Davis said, normalize the conversation and really model these behaviors for us to show young women what it looks like for us to say no, for us to ensure that we are well before others. These are things that I consider in some ways generational trauma. These are things that have been passed down. It makes sense that a lot of us as young Black women and girls, we take care of everyone else before we take care of ourselves, because that's what our mothers did. That's what our grandmothers did. That's what our great-great-grandmothers did. Like, it just goes down the line, but we have the ability to start to make some of these shifts, and to really model for our young women what it looks like to take care of ourselves, to not pour from an empty cup, to set boundaries. And it also looks like, if you are a parent, or if you do play a parental role or a caregiver role, that we are evaluating areas that we're practicing fear-based parenting. I had a conversation yesterday on a talk that I was doing about adultification. So exactly to Brianna's work. And I was recounting when I was younger, I used to like wearing mini skirts, and my mom would hide them. She would hide them. And I just thought she was being mean and cruel and, didn't want me to be fly and great. But now looking back on it, she was afraid. she was afraid of how people would sexualize my body, how people would look at me, how I would be perceived, even though I was 13 years old, but I didn't understand that. And she didn't have the language to have those conversations with me. So I'm not saying don't hide your children's mini skirts, because some skirts do need to be hidden. But what I'm saying is to have these conversations and to also, again, evaluate ways that we can navigate not from a place of fear when we parent, especially as Black parents, especially now today. There are so many things like I'll have to catch myself like, oh, my son's never doing that. And I'm like, wait. I gotta back it up and make sure I'm not navigating from a place of my fear, my hesitation, my anxiety, my trauma that I'm then putting on my child and not having those conversations or just nipping it in the bud. So those are two things that I really think are helpful that we can do as Black women in the various roles that we play in Black girls' lives, is to have more conversations, to evaluate places that we are navigating from fear or trauma in our relationships and our interactions with young women, but also to really start to look at modeling that positive behavior, because these are things that are going to start to be passed down. We're seeing therapists, we're setting boundaries. I'm hoping by the time my son is graduating from college and applying to a job, he's asking, okay, what does real work-life balance look like? What mental health resources do you have in the workplace? How many mental health days do I get? Like, these are things that we should be striving for our next generation. And these are things that we can start right now.
Yes, to everything that has been said before was so brilliant. And if I could just add a few things, and echoing everything that Lauren has said, this work has really been about loving Black girls better than we were loved through our girlhood, and reconciling that. Sometimes it's a painful reconciliation to realize that some of the experiences you had were traumatic, right? And were painful, but we have to be able to do the work to release those things so we can honor the girlhoods of the babies that we're now responsible for. Whether you are a parent or whether you are just part of the village and the community, it means like tapping also into generational healing, right? Reaching back to fetch the spiritual rituals, are the work that our ancestors did far before now to heal. Healing is not new, right? Our ancestors have been doing this work for a long time. And what does it look like to tap into those things and share them with our babies and share them with Black girls? Absolutely, Sankofa. That is a near and dear mantra of mine. And then thinking of how we can navigate our positions of power to reduce Black girls' experiences and interactions with adultification criminalization, right? In our positions of power, how many of us are going to schools and assessing the dress code and saying, this actually is not right? This is not going to work for our babies. Assessing the counseling that Black girls are receiving, ensuring that they have spaces that are restorative in their schools, right? Supporting organizations that are doing that work, right? And so making sure that in our positions of power, that we are truly operating as the villages Black girls need, and standing in those gaps and doing the work, doing the adult work, right? Because much of this work is not children's labor, right? So how are we as adults ensuring that we're doing the labor to ensure that Black girls are truly able to tap into free and liberated lives?
Every time I have the opportunity to hear you guys speak, I am so inspired. Thank you. One thing that you all kind of touched on that I think is so important is the myriad forms of trauma that we as Black women and girls experience on a day-to-day basis, that we, and many of which we are not even conscious of, right? Like the generational, the historical trauma that we carry with us that definitely impacts how we interact with the world, with each other, with the institutions that we engage with, how we understand the way that they perceive and understand and see us. That is all understood through this lens of trauma that we're in effect born into. And then also the kind of constant assault that we deal with in the spaces that we go into. I remember when we were prepping, Dr. Davis, you mentioned, right, like the workplace trauma that we deal with, like the microaggressions and just the accumulated burden over time of having to deal with that, and how that we need to fill our own cups, take care of that, restore ourselves, right? Like there's the the plain, little folder thing where it's like, take care of yourself, put your mask on before you can put on other people's masks. And I think that's just such an important thing for us to remember, that this is work that we have to do in order to take care of and create these restorative spaces for Black girls so that they have less of this to deal with. I want to say they have none of it, but there's a lot of work we have to do in this world before we get there. Thank you. Another thing that has come up and I think is so important, and I'm hoping you guys can share more about, is just the barriers that we encounter as Black women and girls trying to access mental health services and support. I think the traditional mental health model, for a number of reasons, does not necessarily always work for Black women and girls. And our current medical establishment is not as keen or as open to, I think, the more kind of community-based strategies that are emerging in Black communities. I'm hoping that you guys can talk a little bit more about what you understand as the barriers to accessing mental health services and support and emotional well-being support for Black girls, and the ways in which the work you are doing has started to remove those barriers and even remove those barriers altogether. Dr. Davis, you are unmuted. I love it.
I think that one of the primary issues is racial bias from providers. So, and that extends to mental health care. So I unmuted myself quickly because I wanted to share with you guys something, a personal story. So about a year ago, I had a terrible, terrible allergic reaction. I was really terrified. My face was completely swollen. So I drove myself to the emergency room as fast as I possibly could. So I got there, they got me in, they got me seen quickly. And so this white male physician came to me and he said, well, what have you used today? And it didn't click to me initially. I thought, I'm here because I've had an allergic reaction to something. And so I said, well, I'm not on any medication. And he asked me what I'd eaten. And then he said, well, what have you used? And it was in an accusatory way. And when I repeated this story to people, some of whom didn't look like me, they said, well, Jen, they probably ask everybody that. There's a gut feeling, when they're asking you that because you're a Black woman who's walked into the ER. And I was as cute as I wanted to be that day. I'd just come home from work. I had a cute outfit on. I thought there's no reason for him to ask me that. And so it was a time when I was vulnerable. Which is a difficult thing for me to experience, like many Black women. And so that experience, unfortunately, happens in mental health care all the time. So white people are twice as likely to have an opioid overdose than we are, but we are far more likely to be tested when we go in for treatment. Black children are less likely to actually experience psychotic disorder symptoms. We are far more likely, though, to be diagnosed with those psychotic disorders. And then we're not offered treatment. So we have the problem of access to care. And then when you finally walk in and say, I'm going to do something about this, you're shut down. And so it's a personality trait, I suppose, but I like to name it when I see it. And that's part of how we reduce this happening. You name it, you call it out every time you see it.
Thank you. Lauren.
Thanks, Dr. Davis. I think for me, kind of coming from the consumer side, it's looking at it from two different lenses. I think one, we have to have a better understanding of the provider side. And what that means is too often someone will try to go see a Black therapist, just being candid, try to go see a Black therapist, and they'll find out, oh, the Black therapist doesn't take insurance. Why the heck does the Black therapist not take insurance? Well, in all actuality, which a lot of people don't know, is they don't take insurance, one, because the process to bill through insurance is ridiculous. And the rates at which they're paying these providers are minimal. And in a lot of cases, Black providers are completely overloaded because they are such a small percentage of the overall provider base. And they're really standing for the community that they don't have personally the time to go through all this insurance stuff. On top of that, we're not understanding as the consumer that your insurance wants you to have a diagnosis. So how do you go in and diagnose someone as being a Black woman? You know, like right off top, you're going to have issues because your insurance providers want you to be diagnosed with something and say, hey, this is how many sessions it takes to cure PTSD. This is how many sessions we will cover. So it's educating the consumer base and young Black women on what it looks like from the provider side. So one, we can get ahead of that. We can access resources to organizations that have extensive provider networks. This time right now is the time to go to therapy. I tell people that for so many reasons. One, there are so many organizations, Black Girl Smile included. There's so many others out there that have extensive provider bases that specifically are women of color, that really highlight the providers of color that we can reach out to within our states or even, outside of our state as well. On top of that, if we live in a rural community, in a lot of cases, you can work with someone virtually who's in a metropolitan area. So previously you didn't have access to a provider who looks like you. This is a time, if that has been a barrier, this is a time to find a provider that looks like you who works within your state. We're also starting to change some of the laws around providers only being able to see someone within their state. So there's plenty of providers who are in Oklahoma but are licensed in 5 states. Now they have a lot more individuals that they can work with. The last thing I will add there is we should not be going to therapy in a crisis. We need to be going to therapy earlier. We need to be going to therapy when everything is going well, because that's when we can tidy up the stuff that has happened in our past. That's when we can deal with the trauma. But if we're going to therapy only when we are sick, only when we're going through a crisis, we're not really going to be able to deal with the underlying issues that have brought us to this point. And then on the provider side, I think we need more supports for providers. We need to create more accessibility for young people to be aware of providers, of the behavioral health community being a track that is attractive, that is helpful. There are a lot of young people who want to go into medicine these days. We know, I can speak personally, a lot of individuals in my family are doctors because they were poor and they thought, okay, this is who makes a lot of money. But if we can start to expose young people to the behavioral health field as being another track that they can go, that they can still serve, that they can still, maintain lifestyle or get to a lifestyle that they want. So creating more resources for providers, assisting with therapy, with scholarship programs for providers who are in graduate programs, things like that are going to be really helpful for us to start to increase these numbers, because us seeing 2%, 4% of providers being providers of color, that's not even getting into, female providers of color. That's just providers of color. So for us to start to increase those numbers to get to some of the things that we've been talking about today and what Samantha mentioned, of us wanting to have providers that look like us, we've got to start to increase those numbers. But we've also got to start to educate the consumer side of what it looks like to work with a provider and really sticking with the course. I find too often people will say, oh, okay, well, I went to see a therapist, but it didn't work out, so I just didn't go to therapy anymore. That's not how it works. You don't just, your OB doesn't work out and you just don't go to an OB ever again. You have to stay the course. You have to be dedicated to the process. And sometimes it takes trying out a few providers before you find the right provider. We've really got to start to educate young people on what that process looks like and create more resources. Last thing I will say there is there's organizations like ours that are trying to decrease the barriers to access, specifically as it's related to financial and for finding representation. So we have a therapy assistance program where we cover between 10 and 15 sessions for young Black women to work with a licensed mental health professional. About 90% of the providers that we work with are women of color. So we've been able to find these providers, get the money into their hands very easily to work with these young women, and also to connect the young women with providers who innately, but also have gone through training to understand the experiences and the unique stress factors that young Black women experience as it pertains to mental health.
Yes, yes, and yes. I felt like that was a drop the mic moment. So I'm just so here for that. That was absolutely everything. Um, and I do not feel like there is much to add, but I will say that coming from JBG's perspective, and although we're not predominantly a mental health organization, thinking about how we as adults, we as Black women can reduce the barriers for Black girls to access mental health resources and ensuring their overall wellness. And that looks like being advocates for our girls in academic spaces. Largely, our Black girls do not have access to mental health, right? And that happens through not just, they don't, as children, they don't have the right to just sign up for therapy. They have to have consent. They have to do a whole bunch of other things, and helping them to navigate that process. And what that looks like for us is talking to parents, right? Enlightening parents, because all parents are not familiar with mental health, and it means reducing their own stigma and assisting them with education, and not shaming parents through not understanding mental health and wellness, but actually teaching them with love, right? And exposing them to resources that they wouldn't otherwise have access to. Prior to doing JBG full time, I was a teacher, and much of my work looked like talking to parents who were not familiar, who did have a stigma of mental health, who didn't want to address the fact that their baby was struggling with something, and exposing them to resources and organizations like Black Girls Smile that can assist them in doing this work. And so even if we're not doing the work, we can connect folks with people who are doing the work, right? And so it's on us to be super knowledgeable, because being a village doesn't mean you have to know everything, but it means you have access to everything. And so you tap into your resources, right? And so that in and of itself is empowering. So for us, it looks like tapping into resources that are doing the work. It also looks like exposing Black girls to healing work through literature, through media, through music, through love, some of the ways that they can start to create rituals for themselves. As I'm navigating through therapy, I'm learning how to create ritual of self, right? And I share those tools. So some of our babies will not have access to therapy immediately, right? But what does it look like to share what I've learned through therapy with my babies, right? And so we will take them through the practice of doing that. We're going to start having a spiritualist offer rituals, right? And doing those things so that we're sharing their experiences and the gems and the tools that we're learning. Again, passing down not just generational trauma and teaching them about their criminalization, their adultification, but also teaching them about their restoration and their healing. And so I know that all of us can do that work, that we can tap into resources that are wholly committed to mental wellness, right? But then also tapping into our wholeness and healing in a way that we can pass that down to our babies.
Thank you. I don't know if you guys are looking at the chat, but it is on fire. People are really appreciating, and what you're saying is really resonating. I just want to flag for folks who are attending, our fact sheet does have information about Black Girl Smile and Justice for Black Girls. You can learn more about the work that they're doing there. There's also a number of resources to help Black women and girls access mental health services that are noted on that fact sheet as well. Also, look at the chat, because there have been a number of resources that people have dropped in and shared, and a lot of advice. So thank you all for all of your activity. Brianna, you said something that I think is so important, and you guys have all said this, but one thing that has really come up is, how do we start thinking about community wellness and generational well-being, and how do we continue to keep focus on this kind of person-centered model while expanding into thinking about the community well-being, mental health, and wellness? What are ways in which we can create spaces of restoration and healing in our communities? That you guys are doing this every day. What's the work that you're doing, and what's the advice you would give to folks who are joining this call about how they can continue to carry this work forward in their communities?
So this is the part that gets me really excited, because I think it started with just imagination, right? And so we spend a lot of time talking about what is, but I think some of the beauty of life is leaning into imagination and innovation and what life should be, and creating that. So at JBG, we started creating Black Girl Liberation pledges, and we had girls create their own pledges to Black Girl Liberation and start dreaming and imagining. Then we lean back and we reach into and we think about Sankofa, and we lean into Nikki Giovanni's work of Revolutionary Dreams about what does it mean to just kind of internalize that you being that you are revolutionary in your being, right? You just being a natural girl doing what a natural girl does when she's natural is in and of itself revolutionary, right? And then we start thinking about how poetry is not a luxury within Audre Lorde, and then we start leaning into music like Holy, the song that we listened to on our way in about you're waking up with your mind set on loving yourself, right? And so you start creating these rituals that invite wholeness and that invite healing with you, and you start journeying. And this is not to say that every day is perfect, right? But you start creating the spaces that allow you to imagine life beyond the confining structures in which you currently live, right? And so that's our mantra. And with it being our mantra, we are really passionate about creating these spaces authorized by love and liberation, rooted in sisterhood and rooted in truth and honesty and transparency with ourselves. And so that we're able to really dream and define, right? In the words of Toni Morrison. And so much of our work really is about leaning into that love and what love looks like in practice, and knowing that we can create the world that we've always deserved.
Thank you. And Jennifer, Lauren, what can we do to create restorative spaces in our communities? What do these look like? What's work that you're doing that carries that forward?
I think that, again, when we talk about mental wellness as a community, that everything circles back to reducing the stigma, talking about how you feel. It's small things. It starts in your family. When your aunt says somebody's crazy, you talk about that in the moment, because what mental wellness actually mean? That I think that it's really important, again, when we talk about it as a whole, as a community, that reducing stigma is so important.
The last thing that I would add is being really responsive. I think that that's what's so unique about this work and working with Black women and girls is, you take any other kind of social issue, and there's normally like one inflection point, like this is how we're going to fix it. We're just going to stay the course. And I think with the work that we're doing with Black women and girls kind of across the board is something that there's a million points that we have to come in, and we need to stay really responsive about things that are going on in society, things that are going on within our communities, things that are going on with our young women. For instance, for us, one of the things that we're currently working on, or a few of the things that we're currently working on that we can kind of consider in this responsive bucket, is initiatives focused on Black female athletes' mental health and well-being. We saw Naomi Awasaka, then we saw Simone Biles, we saw Sha'Carri Richardson. Like this wasn't one athlete. This isn't, just an anomaly. This is something that's really going on with our young Black women and something that needs to be addressed. So looking at what are things that are going on and how can we be responsive to those are going to be really important. We've also looked at, for instance, when we do some of the listening sessions with our young women and we're having conversations, we've heard a lot around friendships and conflicts and peer conflict, and looking at what it looks like to add some mediation trainings, how it looks like to do some friendship workshops, but really trying to not just say, okay, this is what we're doing and this is the only way it can be done, this is the only timeline, but really looking at what is going on with our young girls and how can we be responsive to those needs, I think is what's unique. And to Brianna's point, like innovative about this work is we have to kind of stay agile. And that's something that is interesting kind of in the nonprofit space, especially with being beholden to funders and donors and things like that. Like they want you to say, hey, this is what I'm doing today and this is what I'm going to be doing tomorrow. But, I push back and say, I can't promise you that. I can promise you that I'm going to continue to serve these young women. And at the core, we are trying to empower their mental health and well-being. But if they need something different tomorrow, then we're going to work to meet that need.
Thank you. That's a really great place for us to pause and open up the Q&A, which has been active. So I'm sure folks have some questions. Please drop them in the chat and we will address them. In the meantime, while we're waiting for a few questions to come in, I do want to let folks know that we have created a post-event survey that we'll be dropping in, that we would love your feedback on how this conversation went. And so you should be seeing that in the chat. So please fill that out. So let's see, what do we have here? Gail Lewis says, excellent conversation and so happy that we are calling out the need and importance of mental health services. As a healthcare professional for over 40 years, it was a travesty when mental health services were minimalized and defunded in the healthcare system. Well, it looks like we still have a little bit of space while people are thinking about questions. So another thing I wanted to ask folks about is, what are some simple things that anyone can do today to support their own mental health and wellness, as well as their communities? You said it a little bit, but I think, as we're wrapping up, this is the time to really hit it home so people know what are the takeaways and what they can do.
Resources are so important. And I've been so excited to see in the chat here, therapy for Black girls, that is huge. And I've seen so many people say that they found their therapist on that site. And so that's www.therapyforblackgirls.com. And then there are other sites. I always recommend APA, the www.apa.org to find a therapist. Great, so somebody put it in the chat here, but it's so important that we have access to resources.
Yeah, just to echo that, two sites that I really like, Psychology Today has amazing filters on there. So if you are looking to go through your insurance, if you have a specific issue that you are looking to address, Psychology Today has really great filters. And you can also filter on Black therapists. You can say African-American, I only want to see an African-American female therapist. And they'll filter on there. And then also Open Path Collective. Open Path Collective is going to be your sliding scale for most providers. I think individual therapy is like $60 a session on Open Path Collective. So I think that's a great resource, especially if you're not looking to go through insurance, but you still want to keep costs as minimal as possible. Open Path Collective is a great resource. And then I think someone else asked like how to kind of push back on funders. Whew, that's a whole other thing. I would say, just being honest and being upfront about your mission and the work that you're grounding in. For me, that is definitely indicating to the biggest kind of pushback that we are having right now is funders that want us to get back in person, and we're really evaluating kind of on a day-by-day basis where we feel comfortable being in person, given where things are with COVID, and because we are a national organization, like where exactly they're looking for programming. So we're very upfront with funders before the check is cut to let them know, hey, thank you for this opportunity, but we want to be very clear about some of our organizational guidelines. And we haven't had anyone say, oh, well, we can't do it. They ask us to keep them updated on any developments or things like that. But it's an ongoing process, finding the best ways to communicate with funders. And then I think to Sydney's question of like what you can do today, I would say evaluating your coping skills and self-care methods, regardless of what has happened for us individually, but also individually during this time. We have all gone through some sort of collective trauma. So making sure that we're finding ways to lean into our self-care. I know that can be really difficult as Black women. At times we don't even know what what self-care looks like. And it doesn't always have to be spa activities. It can be reading a book. It can be taking a nap. It could be doing some breathing exercises, really evaluating what are your personal self-care techniques that you can implement. And then also evaluating our coping skills. This is one thing that we really focus on with Black Girl Smile, because I realized as I got older, my coping skills were horrible. But that was because the coping skills that were modeled for me were horrible. So, and I have to say, I just think kind of in the US, our coping skills are horrible. So finding ways to make sure we're dealing with difficult stuff in positive and healthy ways. That's really what it comes down to. And if we find that we're not handling stress, anxiety, or trauma in healthy ways, we need to find ways to replace those unhealthy coping skills with positive and healthy ones. So that may be taking a break, it may be stepping back, it may be journaling, counting to 5, setting some ground rules for yourself, setting some boundaries in your communication with others, but making sure that people don't take you there is really what I mean, because it's draining to you, and you just are not able to show up as your best self. So the more we can focus on coping skills and self-care methods, it's going to go a long way.
Thank you so much. And that is so true. I feel like I have learned over the years that I realize I'm anxious after the fact. It's like, I'll look back and be like, why couldn't I breathe? Why did my body feel this way? And it's after I've come through it, I'm like, oh, that was stress. I wish I could have known that in the moment. Another really important thing that you said and was in the chat, I think, about funding is so important. So many of the programs that are in schools, that our foster care system and our juvenile justice systems prioritize are these evidence-based models that, data says are effective for kids of color, but they were not designed with or for by kids of color or our communities. And so one of, I think, the importance of figuring out how we work on generational trauma and create these spaces of restoration is because we need more access to programs for Black girls in our communities. That to me is one of the most essential things if we are going to keep kids out of the juvenile justice system, is making sure that we have the funding, we have the visibility, and this is true for adult women too, right? The women that you're working with, Dr. Davis, if we had these services in our communities today, we would have a much smaller footprint in our prison systems and our juvenile justice systems. Kids would be graduating from high school at higher rates, right? And it's all about the visibility of the work that the three of you are doing and many of the folks who are on this call. And we have to fight for that visibility. And that is just so important for us to elevate that this is something we need to be doing collectively. Brianna.
Yes, I'll be quick. I just wanted to recommend 2 books that I think are important. For grown folks, Black women who are doing this work to honor our inner Black girl children, because we're all parents of the inner Black girls that live within us. And so we're actively nurturing those girls who were harmed and whose girlhoods were interrupted. And so that first text is Mourning My Inner Black Girl Child. It's by Reed Botts, a close friend of mine who is doing incredible work. She has launched Black Woman Healing, and she's doing work out of Oakland in the Bay as a doctoral student at UC Berkeley. And then Dr. Monique Morris's Sing a Rhythm, Dance a Blues, Education for the Liberation of Black and Brown Girls, for those of us who are trying to figure out and find simple strategies to share with our school systems and the systems that our youth interact with daily as we think about restorative justice and as we think about healing justice and transformative justice in schools and in spaces that Black girls occupy.
Thank you. And then Dr. Davis, you unmuted.
I just wanted to circle back to what Lauren was saying earlier about the importance of coping skills and boundaries. So we have these arsenal of coping skills, but we have to constantly reevaluate what works for us now, what works for us in the midst of a pandemic, that the things that I could do 2 years ago I don't necessarily have access to those things now. So coping skills are incredibly important, as are boundaries, but boundaries in every aspect of your life. Boundaries at work, boundaries with your spouse, boundaries with your families, boundaries everywhere. So the idea that no is a complete sentence is really, really important. So I just wanted to go back to the importance of both of those things.
So important. One, I think the most important lessons we can learn is to say no, right? And feel comfortable saying no. Because when you say no, you are saying yes to other things, right? So we are coming towards the end of our time together. I want to just say thank you all so much to the panelists. You are brilliant. You are inspiring. It is just an honor and a privilege to be in community with you. And as shown by how active our chat is, your expertise and your brilliance has inspired all of us today. And I just want to say to our attendees, because today is not a thought exercise, but a call to action, I want to ask you all to drop in the chat one thing you will do to nurture, restore, and sustain the mental health and wellness of Black girls. That can be an individual act, it can be collective action, it can be sharing words of encouragement, to calling for legislation that expands and transforms the mental health care system in our country. But whatever it is, let's right now start planting the seeds of what our action will be. I'm going to read some of those off as I see them. We've got encourage them to rest, believe them. Creating spaces in our community for Black girls, acknowledge their presence in positive ways. Bring awareness in my community, love them. The chat's moving so fast, I can't keep up. Advocate. Thank you guys so much. There's just so much wonderfulness that's coming through in this chat. I also want to let folks know that NBWJI is giving away some swag to 3 random attendees. We will be doing that drawing after today's event, and in the update recap email that's coming out tomorrow, we will have that information for you. So keep your eyes peeled and your fingers crossed that you have some stuff coming to you. And last, I just want to thank everyone for joining. We have another one of these wonderful conversations in our Let's Link Up Your Voice Gives Me Strength series. The next one is on January 11th, 2022. Yes, we are planning that far ahead. And it is on, that is Human Trafficking Awareness Day. And at that time, we will be discussing the invisibility of Black women and girls in our narratives around sex trafficking in this country. So thank you again to our incredible panelists, Dr. Davis, Lauren Carson, Brianna Baker. You guys are amazing. The work that you do is incredible. And I am just so appreciative of all that you do and to have been in conversation with you and hoping that we can continue this relationship and this work together in myriad ways in the future.